This is such a loaded question, and it really goes to show the extent of endometriosis as a whole body disease. Yes, it's not just a bad period. It can cause anything from severe abdominal swelling, painful swelling, to dysfunctional bowels and even chest pain, because yes, thoracic endometriosis is a real thing. Honestly speaking, I don't think that supplementation alone can help tackle endobelly, an overactive bowel, or chest pain. Endobelly can have so many contributing factors. Is it just endoinflammation in your pelvis? Is it bowel endometriosis? Is it your diet and lifestyle, high stress or high cortisol levels? How active are you really? Then you have to consider things like conditions resulting or consequential of endometriosis. So endometriosis inflammation can disrupt gut health, whether it's on the gut or not, and that can lead to issues such as leaky gut or SIBO. If you suspect that you might have SIBO or leaky gut, or that you're generally consuming an overly inflammatory diet, then the main approach to tackle any of those conditions is elimination dieting. And each condition will have its own rules that you're meant to adhere to for a minimum of 4 weeks. So it's either 4 to 6 weeks or 4 to 8 weeks. Now, elimination diets seem to be quite controversial, especially within the endometriosis community, because of women not finding relief as a result of trying them out. But the reality is that endometriosis can be so active and so progressive that really only surgery can help eliminate certain symptoms or provide some kind of relief. Generally speaking, elimination diets allow your gut to have some kind of a reset, some reprieve from a diet that is most likely high in ultra-processed foods, high in trans fats, high in sugar, you name it. It restricts you and gets you to only eat foods that are less likely to disrupt your gut health. Personally, I find them to be very effective. I've done Candida diet, I've done the low FODMAP diet for SIBO, I've done the autoimmune protocol AIP diet for leaky gut, anti-inflammatory diet, and when I had that episode quite a while ago of what I suspected to be histamine intolerance, I also looked into doing a diet that was low histamine, and then going forward I created an elimination diet that integrated all of those things after learning what more or less is safe for me and what triggers me, and I adhered to it with the 80-20 rule. So 80% of the time I'm sticking to it, 20% of the time I'm letting myself color outside the lines. So elimination dieting would be my first point of call. In terms of supplementation, there are supplements that can help in terms of reducing inflammation, reducing oxidative stress, so antioxidants. Your antioxidants are vitamin C, glutathione. To reduce inflammation, you're looking at omega-3, magnesium, I like glycinate and malate, zinc, PEA, my new favorite pain relief supplement for endometriosis, which is produced by Nerve, where I have a 15% of code. I do encourage women with endometriosis to try it. It's the only one I can think of at the moment to help support the management of chest pain, because thoracic endometriosis is so understudied that we don't know enough about it to understand if there are alternative modalities, alternative therapies that women with endometriosis can try aside from pharmaceutical intervention or surgery, which of course is very high risk and lacks specialists. PEA reduces neuroinflammation, which in turn reduces pain. It's been clinically studied. It's been seen to be effective in women with endometriosis and in women with other correlating pain conditions like fibromyalgia. I'm also really intrigued by breathwork. I enjoy it personally, and ever since my diaphragmatic endometriosis diagnosis and surgery, I've been wanting to do what I can post. There are so many different kinds of breathwork out there. I'm currently looking into various ones that I hadn't heard of before they were recommended. So if you are actually keen to learn about it as well yourself, do let me know. On top of the supplements I mentioned, I would also recommend vitamins B6 and B12 and fiber in the form of psyllium husk. Now, I try to incorporate fiber via fresh fruit and veg and complex carbs. Fiber is prebiotics as well, so it's good for your gut health, but I actually think I'm not taking it enough. So now and then I will supplement with psyllium husk. Psyllium husk is absolutely horrific. It's like gunk in my opinion, but it does the job, especially when you first start using it. Oh my god, mind-blowing bowel movement. It's like a powder. You have it with liquid. I go for water and some drops of lemon juice, and make sure that you consume water afterwards. I'm not talking liters and liters, or downing large quantities of water, but slowly sip up to a litre of water after you've consumed it to help it pass through your digestive tract. Otherwise you can risk becoming constipated. And then of course there are other supplements like butyrate, glutamine and probiotics. Probiotics, that's quite a complex topic. You kind of have to look into the various bacteria strains to ensure that it's the most suitable one for your symptoms. Yeah, I think that more or less covers the supplements that I've researched and that have worked for me and that I currently take on a daily. So I really hope that that helps in some way. Always look for high quality supplements, read the ingredients to make sure that you understand the vast majority of them and that they don't include things like sugar or dairy or fillers.